So what would you do if this hideous looking creature came and tried to eat up your intestines? Would you run? I'm pretty sure you would. I would too. Hello, my name is Ebony Jackson, and I'm a student physical therapist assistant with Jeff State, and today I'm here to talk to you about Clostridium difficile. Okay, so I can finally say a big word, but what is it? Well, it's bacterium that's normally present in the body, most people, and it's commonly present also in soil, natural water resources, and also human and animal feces. So if it's so common in people and animals in the environment, what's the problem, you might ask? Well, if there's an imbalance in the intestines, C. diff can grow out of control pretty rapidly. The bacteria begins to release toxins. These toxins release inflammatory response, which damage the lining of the intestinal system, and it leads to serious illness. The more severe the inflammatory response, the more severe the illness. Say warning, because this is really a serious problem right now. It's the most common cause of healthcare associated diarrhea worldwide. It can present as mild diarrhea, toxic megacolon infection, sepsis, and can even lead to death. The incidence of C. diff is drastically growing as we go forward. In 2014, according to the CDC, there was 16,345 cases reported, and this is over 35 counties with only 10 states, including Tennessee, New York, Minnesota, New Mexico, Maryland, Georgia, and a few others. Well, another study was done in 2015, and it had increased to 17,354 cases. And that's just looking at 35 cases or counties over 10 states. So that's a pretty drastic increase. Populations affected tend to be patients that have been on antibiotics. What the antibiotics do is get rid of good bacteria in the system, and that causes a risk of decreased normal flora and the intestines, which allows C. diff to spread and grow more rapidly. It's also more commonly diagnosed in hospital patients with longer stays, and that's just because they're in that setting longer, so they have an increased time to be able to be exposed to C. diff. Also, those with comorbidities such as renal failure, diabetes, and inflammatory bowel disease, they're also at higher risk, and that's because they're just more susceptible because they have other things going on as well. So their immune systems kind of already diminished because of that. Patients undergoing invasive procedures, and that's because typically patients that are undergoing invasive procedures, they're in the hospital longer. So again, that goes back to patients with longer stays. They just have a longer time frame to be exposed to C. diff. Patients with advanced age, that is seen, or advanced age is considered 65 years and older, and that's probably due to their weakened immune system as well. And those with weakened immune system in general, so not even including age or anything as a factor, but just those people who have a weakened immune system. Diagnosing C. diff, the earlier the diagnosis, the better. That's mainly because the sooner you can diagnose it, the sooner you can get that person into isolation and begin to treat before they can infect others. And currently the standard for diagnosing is a stool culture, which is followed by identification of toxigenic isolate. And they're looking into faster studies or things that have a faster return on diagnosis. They like to do two-part tests because that just solidifies that it is a positive test. And also they are looking into tests that are more sensitive to C. diff, so it can be an accurate diagnosis. C. diff prevention and control. Here I have precautions. That's the most important thing. Proper hand washing, the old-fashioned way. Washing with your hands with soap and water for 2 minutes A lot of people have gotten really dependent on alcohol-based hand sanitizers. This is not the answer. You need to wash with old-fashioned water and soap. And also, you want to dry properly. So not only is washing important, but drying properly is important, because what drying does is that gets rid of the spores that are sometimes left behind with this particular bacteria. Also, while cleaning, you want to use chlorine-based disinfectants. So sometimes alcohol-based disinfectants do work. However, you don't want to use those because it's only a small window when they work. So just to be safe, err on the side of safety, and always use chlorine-based disinfectants. And also isolation for the patients that have it. You want to go ahead and keep them separate, as well as their equipment, and use any disposable equipment when possible. Okay, treatment. So usually if a patient is on antibiotics, and that's primarily the cause, the doctor will go ahead and suggest that they be taken off those antibiotics. Also, metronidazole and vancomycin, they are used, they're really effective in treating patients with C. diff. That's the most common treatment, but also we have seen, or studies show that donor fecal transplants into the intestinal wall has helped treat patients with C. diff. And also, when looking at treatment, there's a high chance of a patient getting the disease again. There's a 20 to 30% relapse, which is common. There's a 20-30% chance that relapse will occur, and that's not because that the medicine didn't work or the treatment didn't work per se, but just because, or that's not saying that the patient isn't responding to the medicine in general, but it's more so because the more we look at this particular disease, the severity is getting worse. It's getting more severe, and the strains are getting stronger, so it's just harder to fight them off. So, what can I do as an SPTA, or you do, or we do as future PTAs and everyone else in the healthcare field? It's important for us to follow disease control practices. That's the main thing. Just following everything that we've been taught about contact precautions, about proper disposal of things, about keeping patients isolated, not sharing equipment, what I went over earlier, you're using chlorine-based products and things like that. These come in handy. Gloves, not only proper use of your gloves, but also proper disposal. So before you even enter the room, put your gloves on and your gown, and trash it before you leave as well. And also educate the patient and the family. It's very important that they're part of the team as well, to make sure their family is okay, that they don't continue to spread the disease. So it's very important as therapists, since we come in contact with the patients and the family, to educate them. And also therapeutic exercise, because a lot of patients will feel weakened. They're tired. They may have pain. So it's just important to address those issues depending on the patient and the symptoms they're experiencing, to make sure that they still benefit from therapy. Because they're probably there because of other issues, but now they have to deal with this as well. So we just want to continue to treat effectively. All right, well, that's the end. Oh, thank you for the applause, but that's the end. Thank you for listening. I hope you learned something. Ask me questions. I'll be happy to answer. Have a good night.